And so now I'd like to introduce one of the giants in our field that I'm so grateful to work with every day. Margaretta Page is a lifelong neuroscience nurse and has worked to advocate for the needs of caregivers and how important it is that they're incorporated into the care of our patients. And I'll yield the floor to her. And I'm so excited to hear, Margaretta, you share your expertise as it relates to the strategy for including caregivers in the plan of care.
So thanks for having me here to be part of this day. I'm really grateful. And as Dr. Wirejour mentioned, I come from UCSF, where we are lucky enough to have a team who's dedicated to look after the needs of the caregivers of our brain tumor patients. And our team provides direct outreach to provide caregiver assessments, educational information, emotional support, connection to the caregiver resources that are out there. And we offer a variety of programming that's designed to specifically meet the needs of the neuro-oncology caregiver. And I think all of you who've cared for a brain tumor patient would agree that this disease impacts not only the patient, but it really does impact the whole family. And at UCSF, we believe that the caregivers are part of our care team, and that in supporting them, not only do we improve the quality of life of the patient, but we also support the caregiver as well. So I'd like to take the next couple minutes just going through some simple steps that each of us could take, whether or not you have a caregiver program team, to support our patients' caregivers as part of our patient care. So when we think about the caregivers of brain tumor patients, here's what people like Eric, the father of a former patient of ours, and others tell us. We know that caregivers want to be recognized by the healthcare team, and that when they're asked, they do report many types of unmet needs. We know that each caregiver's situation is unique, and often their needs are based on both the patient's disease and their unique symptom burden, as well as who the caregiver is, sort of their personality, their coping skills, and the external resources that are out there to assist them with their needs. We know that certain caregivers are at higher risk for distress than others, specifically those of younger age, those with lower levels of social support, those with higher economic burden, and those with higher numbers of unmet needs. And then lastly, we know that neuro-oncology caregiver needs vary across the disease trajectory, often based on the stage of illness. So a relatively recent Cochrane review showed us that the current level of evidence for support interventions to alleviate caregiver burden and distress for neuro-oncology caregivers is actually low to very low. And the authors identified only 8 randomized control intervention studies, many of them pretty small, that focused on or included neuro-oncology caregivers. That said, these studies did show that there was some evidence, for the positive effects of supporting the caregiver on psychological distress, feelings for mastery, and caregiver quality of life. Experts in the field continue to call for larger studies looking at interventions for neuro-oncology caregivers. So some of you might be out there wondering now, so then what should I do? And I want to show you this table, which is a nice summary of recommendations from a variety of organizations, professional organizations. And you can see that they all indicate that we should routinely assess the caregiver for needs. They recommend identifying critical transition points and the common needs. They suggest that we proactively anticipate the needs and provide support and individually tailor our interventions. So when you think about, as a provider, how do you put that into practice? Truthfully, and maybe the most important take-home message today is that on a basic level, this is probably easier and requires less resources than you think. So first and foremost, it starts with a commitment on your part, both to recognize the value and the importance and the subtle difference of including the caregiver in the care of your patients, okay? And I'd like to suggest that perhaps you just allow yourself to pause for a minute and with some intention, really think about the illness from the caregiver's point of view and allow yourself to see caregivers, a couple of who I have pictured here, and just imagine this illness experience through their lens, okay? it's different than the patient's experience. And so often our interactions with our caregivers as providers really does focus on the patient and the patient needs. So I want to invite you just to make a little bit of a shift and then start with just simply asking them some questions. How are they doing? Do they have any other questions or concerns? Or is there anything that they need that would make caring for that patient easier? At UCSF, we have heard time and time again how caregivers are surprised to be asked such questions and how often meaningful it was for them to have been asked. Really, seeing them and recognizing them matters. So the next step is really to put together a caregiver toolbox, what I like to call a caregiver toolbox. And this one can be done with just a little bit of effort on your part by looking for and uncovering the resources that are available to you already in your setting. And truthfully, you can find a lot of these things right on Google. You want to explore what's available for both cancer caregivers and caregivers of patients with neurological illness. So start with your medical center. Do they provide any supportive care services? Some of you might be at a center where they have a big cancer center or perhaps a large palliative care team that offers supportive care programming for patients and families. Okay, it's good to know what those are. Now, some of you might be in a smaller setting or a solo practitioner, and you might not have access to these kinds of resources. And in that case, I would suggest maybe looking out what's available in your community. Now, it might not be specific to neuro-oncology, but there often are services out there for caregivers of patients with neurologic illness and certainly caregivers of patients with cancer. So one I just want to highlight is the Family Caregiver Alliance. It's an organization of caregivers for patients with neurologic illness. They have an amazing website. They have great education opportunities, and they have a service that connects caregivers actually back to their local caregiver centers, resource centers, to help them access what's available to them in their own community. And then I'd like to mention and suggest that you familiarize yourself with some of these other organizations and the online resources. There are some great neuro-oncology and cancer caregiver resource centers that are available to everyone, and you can direct your caregivers to these organizations. I've listed a few of the really good ones right here. All of them have information about the services and the offerings for your caregivers. So knowledge about such resources like these and being able to refer your caregivers to these is a critical tool in your toolbox. So the next step for you is thinking about actually using the tools in your toolbox. And I think it's helpful to have a few specific items ready, a caregiver handbook, maybe a list of specific resources, or a link in your after visit summary, so that when you do uncover a need, you can sort of give or point your caregivers to those resources. I think the more that you ask questions, you will begin to learn and to uncover what are some of the most common concerns. Now, offering emotional support is an important, really important tool. I mentioned it already, and it's something that we can all do, okay? Just acknowledging and listening to a caregiver's concerns really goes such a long way to address some of those complicated emotions and feelings that they are often experiencing. A moment of attentive listening in which you validate and normalize that caregiver's experience really does make them feel heard and understood. And this may be enough really to help them get through that day and sustain them in their work of caregiving. Now, along the same lines, knowledge of support groups is another useful tool. Many caregivers find great benefit in connecting with others that are in the same situation. So it's a great idea to familiarize yourself with these options, both local and online, and have this kind of information at your fingertips. It's a known fact that if a doctor or a member of the medical team recommends a support group, patients and family members are more likely to attend. Okay, so in addition to trying to use your tools, now you want to really try to operationalize your caregiver support. And so you want to get a system in place. Is there a way to systematically support your caregivers as part of your care? So ask yourself, who will do it? When will it be offered? What will you offer? And when you uncover a need, what are you going to do? And that is why I suggest getting that toolbox ready in advance. Set up a system for yourself. I would say start small and then build on your successes. And as time and resources allow, you will be able to add elements based on the needs and the gaps that you uncover. And that is what we did at UCSF. And I think it's worked really well. So in summary, I would like to invite all of you, if you haven't already, just to commit to including the caregiver in the care that you provide. Remember, we know that caregivers want to be recognized by the health team and that they have so many unmet needs. So put together that toolbox and don't hesitate to ask questions, find out what they need and connect them with the resources that are out there for them. I know, and I think you'll see it too, that making the time and taking the effort to include them in your care will make a difference, not only for them, but for your patients as well. So in closing, I would just like to acknowledge this amazing team at UCSF that I mentioned at the beginning of my talk, who does this important work with me.